Hi there, we're back to discuss with you yet another option we can use the Neubie device for. Sometimes our patients come in with neurological issues, meaning some nerves are really contracted and have high amount of tone, and that can sometimes also lead to other muscles or opposing muscles being low tone and almost floppy or flaccid. So when we're talking about a neurological patient, we can use the Neubie and the direct current to help stimulate and turn on those muscles that are not working well, but we can also downregulate or relax those muscles that are highly contracted or in a spastic nature. So right now we have the pads already in place for Ryan, with the example being that his calves are very high tone, almost in a spastic nature where they won't relax, and the muscles in the front of the ankle being on the weaker side and not working properly. So with the Neubie, we can pick frequencies where the pads in the back are being relaxed through a certain higher amount of frequency, and the pads in the front are then stimulating the muscles in front of the calf to help raise his foot up. So when people have drop foot or can't raise their foot up to walk properly, this is a way to help transition them into being able to walk with the proper balance around the lower leg. Ryan and I are back to talk about yet another option we can use the Neubie device. For patients who have neurological issues, we can use this device to help restore and reset muscles that have become imbalanced. What does that mean? With patients who have neurological deficits, we tend to see one side of the muscles being overcontracted, maybe even in spasm, when opposite muscles can almost be flaccid or weak and not active. So we can use this device with certain frequencies to either help upregulate the muscles that are weak or downregulate the muscles that are having too much tone to restore that balance. And a great example is somebody who has drop foot or has an issue where they can't go through a full step because their calves are too tight and the muscles in front of their calves are too weak, and they end up dragging their toe and tripping. So you can see Ryan has electrodes on where two are in the back on his calf to help reduce that tone and relax the muscles, help them lengthen. And then he has two electrodes in front of the calf that are going to help drive the muscle and help him raise his foot up, so that when he carries that over into gait, he's not tripping over his toe, and we have restored the balance in his lower leg. So let's put the Neubie device in action. We're going to take the pads on the back of Ryan's calf, and I'm going to use a setting to help elongate and lengthen that tissue. So Ryan, go ahead and let me know when you feel some of that tingling sensation in the back of your calf.
It's coming on.
Okay, let's put it at about a 5 out of 10 intensity.
Okay, it's there.
Okay, so now we're going to go to the pads in front, and I am going to turn up the stimulation to where it's going pretty good, like a 7 out of 10 intensity.
Okay.
Let me know when you feel that.
I'm starting to feel it.
Okay.
It's probably there.
Stay right there?
Yep.
Okay, so now we're going to have Ryan do some movements to help reinforce the length that we want in the back of the tissue and activate the muscles in front of his calf. So what I'm going to have you do is just kind of come up and down on your toes and do some traditional heel raises. Good, so I would take him through about 10 repetitions of that. And now I'm going to have you go into a stretch for that back tissue. So can you elongate, I'm actually going to have you switch sides, and elongate that calf for me and just feel a stretch. So one of the protocols we can use is an end range activation. So he's going to the end range of that tissue in the back of his calf, and then after that, I'm actually going to have him take the weight through his heel and he's going to lift his toes. So now we're going to activate those muscles that are weak. And remember, the frequencies are helping him drive that muscle. Another thing we can do is then add this into a functional movement pattern. So he's going to take a step. He's going to go through a stepping pattern of raising those toes up, raising the ankle up, and then coming back and getting a stretch through the calf. So pushing through, just like you would do in a normal walking cycle. So we've taken the frequencies, we've manipulated them in a way that's going to work for the deficits we found in our patient. So this was just another example of how we could use the Neubie device to help patients who have neurological issues. And those patients can have multiple sclerosis, they can have spinal cord injuries or traumatic brain injuries or anything where the nervous system has been altered. We can use this device to help restore the balance within that nervous system.